Hi, this is Dr. Anilak from thegentlendentist.com in Shelby Township, Michigan. Our phone number is 586-247-3500. And today we have Colette, and Colette is being so generous to let us video some of the process what we're going to do. We are going to be doing some cosmetic dentistry on her today. And so what I'd like Colette to do is just explain about maybe some of the reasons that you are looking forward to having this done, and maybe some of your experiences so far that we've done so far.
Well, the reason I want to have it done is because I've struggled with not liking my smile my entire life due to originally having my teeth broken off when I was young, and then having to have crowns done at a very young age and having them replaced, and none of my teeth have ever matched, and it definitely prevents me from smiling. I mean, I do smile, but just not to the fullest extent. You know, I'm always conscious of people looking at my mouth, and I'm just ready to change that. And so far, Dr. Anilak has been terrific. The office is very enjoyable, and looking forward to having it all done.
Good, good. Yeah, we're looking forward to this too. We're going to have a few challenges with the fact that she did break her teeth off, and she's got a metal post in there. And so we're going to have to do some things to give a nice, very natural appearance to her teeth. And so we're going to do that. And as we go through this, I'll explain what's going on. Okay. So right now what I did is I just added some tooth-colored composite material to this tooth here and her eye tooth here. And the purpose of that is just to bring these teeth out so they look a little bit more prominent. Previously we had done some bonding on these teeth here to brighten them up, and on the back ones, so we can have a nice uniform color of her teeth. So now what we're going to do is we're going to take an impression of these, and we're going to duplicate this, and then take off these crowns. Okay, so what we have here is we went ahead and I took her old crowns off. This is where she fell and hit her tooth. And this has got what's called a post, and it's got actually a metal post and core. And so we have to try to get here is we have to achieve the same underlying structure. This is called a stump shape, like these two are, and we want to try to achieve that on this tooth. So I'm going to do some special things to bond some composite, block out this color, and try to achieve this color closely so that when these all porcelain crowns are made, that they all look the same. Another issue we have here is with her eye teeth. Eye teeth typically are darker. This one is and this one is. And so we have to also take this color, and so we can achieve our final result, which we're trying to get something like this as a color, which is actually a bleach shade. So we've got to go from this color and make it look natural along the process. So I'm going to actually do some composite. I'm going to bond some material onto this tooth here, and so that it can, like I say, try to match the adjacent teeth. In this impression now, we put this material inside of her mouth, and we're just going to put it up there, and it's just going to stay in there for about 4 minutes or so. And up to this point, she's been using the gas, and she's been doing really well. The procedure's going very smoothly. So what we're going to do now is we're capturing the impression of it. We're going to take a photo of the color that we have underlying what's going to be the crowns and the two veneers. We're going to then send that to our laboratory, and he's going to then fabricate the porcelain off of that. So we'll see what that looks like, and we'll make some temporaries out of a light shade, and we'll see what best we can get to make it look for short term while the temporaries are in there, while the lab's processing the porcelain. We went ahead for Colette, and we put the temporary on for her, and we are going to be sending this out to the laboratory. The color of it is going to be a little bit brighter than we currently have, but they look very nice, very natural. Right now she is completely numbed up, so you're still numb from before, so your lip's not going to have the mobility, but it will be back to normal. So, okay, here's a mirror. Just take a look and see. Okay. So what I did was I went ahead and I brought these eye teeth out a little bit more from where they were, okay, to give you a full, really nice broad smile there too. Like I say, the color's going to be the color the teeth next to them are going to be, so we're going to brighten those up a little bit more from where they currently are. All right, but you actually have good mobility with your lip. Even though you can't feel them, they still move.
And the gum will heal up.
Yeah.
Around, like this will be see, you know, it won't look all
The gums, yeah, we need
Yeah.
to heal the gums
Yeah.
up, but for now, that's what we've got. Yeah, the underlying color of your teeth are really, really dark,
Yeah.
and so but when he does it at the laboratory, he'll be able to brighten those up better
Yeah.
for you. So,
That's
okay?
great. What are the
So-
temporaries made out of?
It's a plastic material. Yeah, it's a plastic material. It'll last for about 3 weeks. We'll have it in for 3 weeks.
Okay.
Okay. So we went ahead and put those on for you, and go ahead and take a look and see what they look like.
They look perfect.
They're beautiful.
Mm-hmm.
Oh my gosh, it looks so nice.
Yep.
You were able to really mask out that one dark tooth really nicely, and
Yeah,
it
I
matches
can't even
nice.
tell.
Yeah. So now you can smile. Before, when we started off, you had that around the gums.
Mm-hmm. That's
Okay,
very
let's
nice.
just look at you.
There. All right.
Wow.
So you were telling me when you put the temporaries on that you were smiling a lot. I think you said that.
Yeah.
Yeah.
Yep.
Did you catch yourself smiling?
Yeah, I did, but I also still find myself wanting to hide my teeth, but I'm slowly getting out of that.
So
Have
well, now you have a good reason
Yeah.
to, because they
Yeah.
look beautiful.
They look great. Thank you.
Yeah. You're welcome.
Yeah.
So.
They match the other ones back here really well too.
Yeah.
So.
Yeah. So take care of your loans next in the future, and
Yep.
we're good, man. You're good.
That's
So
good.
so we did some beautiful, nice veneers here, and some all porcelain crowns, and really masked some dark teeth that you had from a long time ago. And so yeah, it's going to take some time to get used to being able
Mm-hmm. Yeah.
to smile confidently and
Yep.
in front of a camera too.
Mm-hmm.
So anyhow, if this is something, if your smile has felt like it's kept you back, then give us a call, because we can do some nice things. We have a great lab that we use locally, Macomb Dental Ceramics, and Rick will do a great job for you. So this is Dr. Analek signing off, and we have a really nice job, and take care. Keep smiling now, right?
Thank
okay,
you,
very good.
yes.
Thanks. Okay, great.
There you go.
Okay, great. You're all set.